Hey there, and welcome to our video on herbal supplements for anxiety. In this video, we'll be exploring some of the most promising natural remedies that have been studied for their potential to help manage anxiety symptoms. We'll dive into the research behind Passionflower, Kava, St. John's Wort, lysine, arginine, and magnesium, discussing their potential benefits and safety considerations. By the end of this video, you'll have a better understanding of how these herbal supplements may fit into an anxiety management plan and what precautions to keep in mind when considering their use. So, let's get started. Anxiety is a common mental health condition that affects millions of people worldwide. While conventional treatments like medication and therapy are effective for many, some individuals seek alternative or complementary approaches to manage their anxiety symptoms. In recent years, herbal supplements have gained popularity as a natural remedy for anxiety. Passionflower, a climbing vine native to the southeastern United States, has been used for centuries as a natural remedy for anxiety and insomnia. 3 human trials have demonstrated the efficacy of passionflower in reducing anxiety symptoms, both as a monotherapy and in herbal combinations. In a double-blind, placebo-controlled study, Akonzadeh and colleagues in 2001 found that passionflower extract was as effective as the benzodiazepine drug oxazepam in treating generalized anxiety disorder, or GAD. The study involved 36 patients with GI who received either passionflower extract at 45 drops per day or oxazepam at 30 milligrams per day for 4 weeks. Both treatments significantly reduced anxiety symptoms, with no significant difference between the 2 groups. However, passionflower was associated with fewer side effects, such as drowsiness and impaired job performance. Movafeg and colleagues in 2008 investigated the effects of preoperative oral passionflower on anxiety in 60 ambulatory surgery patients. Participants received either passionflower at 500 milligrams or placebo 90 minutes before surgery. The passionflower group experienced a significant reduction in anxiety scores compared to the placebo group, without any significant differences in sedation level or psychomotor function. Buring and colleagues in 1997 studied the effects of a combination of plant extracts, including passionflower, in the treatment of adjustment disorder with anxious mood. In this double-blind, placebo-controlled study, 182 outpatients received either the herbal combination or placebo for 28 days. The herbal combination was significantly more effective than placebo in reducing anxiety symptoms with a favorable safety profile. While these studies support the anxiolytic effects of passionflower, it's important to note that mild adverse events such as dizziness and confusion were reported in the Akonzadeh study. More research is needed to establish the long-term safety and optimal dosing of passionflower for anxiety management. Moving on to Kava, a plant native to the South Pacific Islands that has been traditionally used for its calming and relaxing effects. Several randomized controlled trials have demonstrated Kava's effectiveness in treating various anxiety disorders, including GAD, non-psychotic anxiety, and anxiety during benzodiazepine tapering. Volts and Kiesa in 1997 conducted a randomized, placebo-controlled, 25-week outpatient trial involving 101 patients with anxiety disorders. Participants received either Kava extract WS-1490 at 100 milligrams 3 times daily or placebo. Kava was significantly superior to placebo in reducing anxiety symptoms, as measured by the Hamilton Anxiety Scale and Clinical Global Impression Scale. Borner and colleagues in 2003 compared the efficacy of Kava extract LI-150 to the antidepressant drugs opipramole and buspirone in a randomized, double-blind, multi-center trial involving 129 outpatients with GED. After 8 weeks of treatment, Kava was found to be as effective as the conventional medications in reducing anxiety symptoms, with a favorable safety profile. Several other randomized controlled trials have reported similar findings, supporting the anxiolytic effects of Kava in various anxiety disorders. However, some studies have found no significant difference between Kava and placebo, highlighting the need for further research to clarify Kava's efficacy. It's crucial to note that Kava has been linked to rare but serious liver toxicity, as reported by Teschke and colleagues in 2008. As a result, Kava has been banned or restricted in several countries, and caution is advised when considering its use for anxiety management. Individuals with liver problems or those taking medications metabolized by the liver should avoid Kava. Next up, we have St. John's wort, a flowering plant native to Europe that has been traditionally used for its mood-enhancing and anxiolytic properties. However, the evidence for its effectiveness in treating anxiety disorders is mixed. Some studies suggest that St. John's wort may be beneficial for certain anxiety disorders, such as GAD, obsessive-compulsive disorder, or OCD, and depression with comorbid anxiety. Taylor and Kobach in 2000 conducted an open-label trial of St. John's wort in 12 patients with OCD. After 12 weeks of treatment, significant improvements were observed in OCD symptoms, as measured by the Yale-Brown Obsessive-Compulsive Scale. Kobach and colleagues in 2005 investigated the effects of St. John's wort in a double-blind, placebo-controlled study involving 40 patients with OCD. Participants received either St. John's wort at 600 mg per day or placebo for 12 weeks. While both groups showed significant improvements in OCD symptoms, there was no significant difference between St. John's wort and placebo. Wort and colleagues in 2002 studied the effects of St. John's wort extract Li-160 in a placebo-controlled trial involving 149 patients with somatoform disorders, which often involve anxiety symptoms. After 6 weeks of treatment, St. John's wort was significantly superior to placebo in reducing anxiety and depression scores. However, other studies have found no significant effects of St. John's wort on anxiety disorders. Kobach and colleagues in 2005 conducted a placebo-controlled pilot study of St. John's wort in 40 patients with social phobia. After 12 weeks of treatment, there was no significant difference between St. John's wort and placebo in reducing social anxiety symptoms. Given the mixed evidence, more research is needed to establish the efficacy of St. John's wort as an anxiolytic agent. Additionally, St. John's wort is known to interact with many medications, including antidepressants, birth control pills, and blood thinners, so caution is advised when considering its use. Moving on to lysine and arginine, two amino acids that have been investigated for their potential anxiolytic effects. Two randomized controlled trials have found that lysine and arginine combination supplements may help reduce anxiety symptoms and modulate cortisol response in healthy volunteers and individuals with high-trait anxiety. Jozova and colleagues in 2005 investigated the effects of a lysine-arginine combination on neuroendocrine activation during psychosocial stress in 29 healthy volunteers with high-trait anxiety. Participants received either the amino acid combination at 2.64 grams of L-lysine and 2.64 grams of L-arginine per day, or placebo for 10 days. The lysine-arginine group showed a significant reduction in state anxiety and cortisol response during stress compared to the placebo group. Smriga and colleagues in 2007 conducted a double-blind, placebo-controlled trial involving 108 healthy Japanese adults. Participants received either an oral lysine-arginine combination at 2.64 grams of L-lysine and 2.64 grams of L-arginine per day or placebo for 1 week. The amino acid combination significantly reduced anxiety and stress scores compared to placebo, as measured by the state trait anxiety inventory and the profile of mood states. While these studies suggest that lysine and arginine may have anxiolytic potential, more research is needed to confirm their efficacy and safety in individuals with anxiety disorders. Additionally, the optimal dosing and long-term effects of these amino acids on anxiety symptoms remain to be established. Finally, let's talk about magnesium, an essential mineral that plays a crucial role in various physiological functions, including neurotransmitter regulation and stress response. Some studies have investigated the potential anxiolytic effects of magnesium supplementation, often in combination with other vitamins and herbal extracts. Carroll and colleagues in 2000 conducted a double-blind, placebo-controlled trial involving 44 healthy young male volunteers. Participants received either a multivitamin mineral supplement containing magnesium at 100 mg per day or placebo for 28 days. The magnesium-containing supplements significantly reduced anxiety and perceived stress compared to placebo, as measured by the Hospital Anxiety and Depression Scale and the Perceived Stress Scale. D'Souza and colleagues in 2000 investigated the effects of a magnesium-vitamin B6 combination on premenstrual anxiety in a randomized, double-blind, crossover study involving 44 women with premenstrual syndrome. Participants received either the magnesium vitamin B6 supplement at 200 mg of magnesium and 50 mg of vitamin B6 per day, or placebo for one menstrual cycle. The magnesium vitamin B6 combination significantly reduced anxiety-related premenstrual symptoms compared to placebo. Hannes and colleagues in 2004 studied the effects of a fixed combination of hawthorn extract, California poppy extract, and magnesium in a double-blind, placebo-controlled trial involving 264 patients with mild to moderate anxiety disorders. Participants received either the Herbal magnesium combination or placebo for 3 months. The Herbal magnesium combination was significantly superior to placebo in reducing anxiety symptoms, as measured by the Hamilton Anxiety Scale and the Clinical Global Impressions Scale. However, the specific role of magnesium in these combination treatments remains unclear. The D'Souza study found no significant difference between magnesium and placebo in reducing premenstrual anxiety, suggesting that the anxiolytic effects may be attributable to the other components of the combination supplements. More research is needed to determine the efficacy of magnesium as a standalone treatment or in combination with other nutrients and herbal extracts for anxiety management. Additionally, the optimal dosing and long-term safety of magnesium supplementation for anxiety relief remain to be established. In addition to the herbal supplements we've discussed, several other natural remedies have been investigated for their potential anxiolytic effects. These include lemon balm, chamomile, valerian, hops, and various herbal combinations. Lemon balm, a perennial herb from the mint family, has been traditionally used for its calming and mood-enhancing properties. A few small studies, such as those by Kennedy and colleagues in 2006 and Cases and colleagues in 2011, have suggested that lemon balm may help reduce anxiety symptoms and improve sleep quality. However, more research is needed to establish its efficacy and optimal dosing for anxiety management. Chamomile, a flowering plant from the daisy family, has been used for centuries as a natural remedy for anxiety and insomnia. Some studies, like those by Amsterdam and colleagues in 2009 and Keefe and colleagues in 2016, have found that chamomile extract may help reduce anxiety symptoms and improve sleep quality in individuals with GAD and other anxiety disorders. However, the evidence is limited, and more high-quality trials are needed to confirm chamomile's anxiolytic effects. Valerian, a perennial flowering plant, has been traditionally used for its sedative and anxiolytic properties. While some studies, such as those by Andreattini and colleagues in 2002 and Bent and colleagues in 2006, have suggested that valerian may help reduce anxiety symptoms and improve sleep quality, the evidence is mixed, and more research is needed to establish its efficacy and safety for anxiety management. Hops, a flowering plant used in beer production, has been investigated for its potential sedative and anxiolytic effects. A few studies, like those by Carew and colleagues in 2017 and Ross in 2015, have suggested that hops extract may help reduce anxiety symptoms and improve sleep quality, often in combination with other herbal extracts such as valerian. However, more research is needed to determine the specific role of hops in anxiety management and its optimal dosing and safety. Several herbal combinations have also been studied for their potential anxiolytic effects. For example, a fixed combination of valerian and lemon balm has been found to reduce anxiety symptoms and improve sleep quality in a few small trials, such as those by Kennedy and colleagues in 2006 and Tavoni and colleagues in 2011. Similarly, a combination of passionflower, valerian, and hops has been suggested to help reduce anxiety symptoms in individuals with adjustment disorder, as reported by Gibbert and colleagues in 2017. However, more research is needed to establish the efficacy and safety of these herbal combinations for anxiety management. In addition to herbal remedies, some nutritional supplements have been investigated for their potential role in anxiety management. These include omega-3 fatty acids, B vitamins, and vitamin D. Omega-3 fatty acids, particularly eicosapentaenoic acid or EPA and docosahexaenoic acid or DHA, have been studied for their potential anxiolytic effects. Some studies, like those by Su and colleagues in 2018 and Kiecolt-Glaser and colleagues in 2011, have suggested that omega-3 supplementation may help reduce anxiety symptoms in individuals with anxiety disorders. However, the evidence is mixed, and more research is needed to establish the optimal dosing and long-term safety of omega-3 supplementation for anxiety management. B vitamins, particularly vitamin B6, vitamin B9 or folate, and vitamin B12, have been investigated for their potential role in mood regulation and anxiety management. Some studies, such as those by Kafashani and colleagues in 2017 and Young in 2007, have suggested that B vitamin deficiencies may be associated with increased anxiety symptoms, and that supplementation may help reduce anxiety in certain populations. However, more research is needed to determine the specific effects of B vitamins on anxiety disorders and the optimal dosing for anxiety relief. Vitamin D, a fat-soluble vitamin primarily synthesized in the skin upon sun exposure, has been studied for its potential role in mood regulation and anxiety management. Some observational studies, like those by Armstrong and colleagues in 2007 and Bijikova and colleagues in 2015, have suggested that low vitamin D levels may be associated with increased anxiety symptoms. However, the evidence from intervention trials is limited and mixed, with some studies, such as those by Kjærgaard and colleagues in 2012 and Dean and colleagues in 2011, finding no significant effects of vitamin D supplementation on anxiety symptoms. More research is needed to clarify the role of vitamin D in anxiety management and the optimal dosing for anxiety relief. While herbal supplements are often perceived as safe and natural alternatives to conventional medications, it's essential to recognize that they can cause side effects and interact with other substances, including prescription drugs and over-the-counter medications. Before using any herbal supplement for anxiety management, it's crucial to consult with a healthcare professional, such as a physician or a licensed naturopathic doctor. They can help determine whether the supplement is appropriate for your individual needs, consider potential interactions with your current medications, and monitor for any adverse effects. Some specific safety considerations and precautions for the herbal supplements we've discussed include Kava. As mentioned earlier, Kava has been linked to rare but serious liver toxicity, leading to its ban or restriction in several countries. Individuals with liver problems or those taking medications metabolized by the liver should avoid Kava. Kava can also interact with alcohol and other central nervous system depressants, increasing the risk of drowsiness and impaired functioning. St. John's wort. St. John's wort is known to interact with many medications, including antidepressants, birth control pills, blood thinners, and immunosuppressants. It can reduce the effectiveness of these medications or increase the risk of adverse effects. St. John's wort should not be used without consulting a healthcare professional, especially if you are taking any prescription medications. Passionflower. While passionflower is generally well tolerated, it can cause side effects such as drowsiness, dizziness, and confusion in some individuals, as reported in the Akonzadeh study. Passionflower may also interact with sedative medications, increasing the risk of excessive sleepiness and impaired functioning. Magnesium. High doses of magnesium can cause digestive side effects, such as diarrhea, nausea, and abdominal cramping, as noted by Guerrero and colleagues in 2009. Magnesium can also interact with certain medications, such as antibiotics and diuretics, reducing their absorption or increasing the risk of adverse effects. In addition to these specific considerations, it's important to be aware that the quality, purity, and potency of herbal supplements can vary widely between brands and products. The herbal supplement industry is not as strictly regulated as the pharmaceutical industry, and some products may contain contaminants, adulterants, or inconsistent amounts of active ingredients, as reported by Newmaster and colleagues in 2013. To ensure the safety and quality of herbal supplements, it's recommended to choose products from reputable brands that adhere to good manufacturing practices and have their products independently tested for purity and potency. Look for supplements that have been certified by third-party organizations, such as the United States Pharmacopeia, NSF International, or ConsumerLab.com. Several herbal supplements have shown promise in managing anxiety.